I would be waiting for a while others are trying to rejoin the meeting. Okay, so I'll be playing it now.
How are your insulin injections going?
Okay, actually. I was a bit sore the first few times, but I found a really good place here on my thigh where the angle's just right. So I haven't needed the ice pack you suggested. The thing that's worrying me is shooting that first drop into the air, then throwing the needle away afterwards. I mean, that's so wasteful, and we're always hearing how the health service is strapped for cash.
Well, it's really important to make sure the needle's working properly before you inject yourself. Don't skip that bit, because you really need that insulin. And don't worry about the needles. They're designed to be single use. One thing you do need to watch, though, you should vary the site of the injection. If you go back to the same place too often, the skin gets hard and doesn't absorb the insulin so well. So find a few good places and rotate between them.
Oh, yes, I remember you saying that before.
Okay, please type in your responses, the answer choices that you have selected for this question. Okay. Yes, I've got all three answer choices. Some of you have gone with A. So there was a lot of discussion about suitable site, but if you listen to what the patient is saying carefully, I would just share the transcript with you so that it becomes much more easier for you to understand the concept. Yeah, so if you see the transcript here, what the patient was describing is that at the beginning it was a bit sore, but now I have found a really good place on my thigh where the angle is just right. So I haven't needed the ice pack you suggested. So this rules out both answer choices, A as well as B. Isn't it? They are neither worried about the site because they have found it already, and they haven't had pain as well. They didn't need the ice packs. And then they gave a clear sign. What is worrying me is shooting that first drop into the air. So that is one aspect. And throwing the needle away afterwards. So two things about the procedure because it is so wasteful, she said. So she's concerned not about the site. It is not that she hasn't found the site. She has found. It is just that the healthcare professional was then suggesting that they should vary the site of injection. But question is asking particularly what the patient's main concern is. Yeah? So the patient is not concerned about finding a suitable site. They are concerned about the initial drop, the wasteful part of it, just wasting that initial drop of insulin and then throwing the needle after using. So that is why C is the correct answer choice. So even though you have detailed questions, still you would see that the answer choices would not be, repeating the exact word that were there from the audio. They wouldn't say wasting insulin or wasting needle, but there would be an inferential phrase that would be used here. Right? So that is how it is different from main idea questions. If you look at the main idea of this entire conversation, it was mainly about how important it is for them to rotate the site. But the question is not the main idea question. It is specifically asking what is the patient's main concern. And therefore C is the correct answer here. Yeah. She never had any pain, so it helps me rule out B. And the suitable site, mainly she said that she has already found it, and the other instructions about the suitable site came from the healthcare professional and not the patient. So that is also ruled out. Okay, now what we are going to do for next questions is, I would want you to interpret the question, predict what kind of discussion it could have, also look at the answer choices and find out keyword from the answer choice, and then I would play the audio for you. Go ahead. You can have 30 seconds time. Ideally, you get 15 seconds, but that's when you are doing the final preparation of your exam. When you are studying or learning the strategies, it is fair enough to take some more time, because it's very, very important that you understand the question correctly before you listen to the audio. So a radiographer talking to a patient. Yeah, so you see that all the different healthcare professionals are involved here. Here also you have to find out why the patient is anxious. You have to find out keywords from the answer choices, which would help you to differentiate between two answer choices. So operation, may have fractured a bone, or is it the pain? Why is the patient anxious? So it has been almost 30 seconds since we started. Now I'm going to play this part for you.
Now, Mrs. Daniels, I'll need you to keep your arm as still as possible for me. I know you're in quite a bit of pain, so I'll try to be as quick as possible.
I'm sorry, I can't keep it still because I'm shaking. I'm nervous. I may have broken an arm. I've never broken anything before, never had surgery. And the thought of lying on an operating table just frightens the life out of me.
I understand you're nervous, Mrs. Daniels. It's perfectly normal. Just try to take some nice deep breaths, and then when you feel you're ready, we'll start.
But it's hurting me. I had no idea X-rays hurt.
No, it's not the X-ray itself. It's the positioning of your arm. I'm sorry, but it's necessary to take them at various angles so the doctors can see even the smallest of hairline fractures.
Okay, I'll try.
So here also you could hear something about each answer choice. Which one sounds to be the main concern, the main thing that they're anxious about? The patient did have pain, but is it something that they're anxious about? They did use phrases like, it frightens life out of me, isn't it? So for what did they use that phrase? What frightens life out of them? What are they anxious about? May have fractured a bone. Okay. In fact, A is the correct answer here, because they clearly expressed their worry. They mentioned clearly that they haven't had surgery before, and the thought of lying on the operation table is taking the life, or it is frightening the life out of me. So it is true that they had pain. Okay? It was mentioned twice. First, the healthcare professional said that I know you are quite a bit of pain, but that was not the reason for anxiety. They were not anxious because of pain. They clearly said that I can't keep it still because I'm shaking and I'm nervous. So why are they nervous? They might have broken an arm and they never had surgery. The thought of lying on an operating table just frightens the life out of me. So it is true they may have broken a bone. Factually, it is correct, but they are not anxious about that. They are anxious about having the operation. They do have pain. That is also factually correct. But I was looking for a specific detail. Right? This is why I said it is very, very important that you are able to identify the difference between types of questions, and you would need different strategies for those types of questions. For example, if I talk about paracetamol, the paracetamol tablet and paracetamol injection. Yeah? So I need different tools for administering paracetamol tablet, and I need different tools for administering injection paracetamol, although the medication is same. So similarly here, the question format is the same. You have workplace related, conversation. You have the context sentence. You have question. You always have three answer choices. But depending on what kind of question it is, you would need a different strategy. So other two answer choices are correct. They are in great deal of pain. They may have fractured a bone, but they are anxious about having the surgery because they never had it before. So A is the correct answer here, not B or C. And I can see hardly, maybe just one of you could get A as the correct answer. No worries. We are going to still do three more questions that may give you enough opportunity to practice this skill for detailed questions. Okay. This time, no hints from my side. I would straight away play the audio after 30 seconds. Done. Okay, if any one of you doesn't know what is podiatrist, I would just make it clear for you. It is a specialist in the care of lower feet, basically. Find out the keyword from the question, keyword from the answer choices, and mainly try to differentiate between them. Okay, I'll start the audio now.
Well, you've got what's known as a bunion.
It's just so ugly. I've even stopped wearing open-toed shoes. How did this happen? I mean, I'm far too young to have this.
That's actually a common misconception. The condition can be inherited or even associated with diseases of the joints like osteoarthritis. But the most common cause is poorly fitting footwear, particularly shoes with narrow toe boxes.
Most of mine do have rather narrow ends, but surely that can't change the shape of your foot. I mean, my big toe's pointing in the wrong direction.
What actually happens is the metatarsal, which is the long bone in the middle of your foot, deviates towards the other foot, while the hallux, otherwise known as the big toe, pushes towards the other toes, so we get a very prominent joint protruding outwards, such as you have here.
I see.
I hope all of you found this a little bit easier than the other answer choices, the other questions, less tricky. Yeah, less tricky. Yeah, so most of you are right here. A is the correct answer choice because two sentences that they used, both were about the cause. Yeah, it looks so ugly, and they were asking, I'm far too young to have this. How did this happen? So the patient's tone also helps you. The question was asking, what are they surprised about? So if someone is surprised, you know how their tone changes. So here she sounded surprised, isn't it? How did this happen? I'm far too young to have this. And then again, when the doctor was explaining that it can be caused by narrow toe boxes, shoes with narrow toe boxes, again she said that, you know, but surely that can't change the shape of your foot. So again, here she was surprised to know that this has happened because of wearing a specific kind of shoes. Right? And there was nothing about the time that it takes to develop. So it was very easy to rule out C here. B could be confusing because the doctor was actually explaining how the bunion occurs. But then again, that was, she did not express any surprise there. She just accepted it by saying, I see. So yeah, A is the correct answer, the likely cause of it. Okay, let us move on to the next question now. So it is a dentist talking to a patient about implant surgery. What has the patient misunderstood? So you have to specifically find out what has the patient misunderstood about the proposed treatment. So you can understand what kind of conversation this is going to be, because they are going to talk about implant surgery. That means the patient is probably about to have the implant, and the dentist might have already explained something to the patient, but the patient has misunderstood that. So you have to listen to where, in which place the dentist is trying to correct the patient when patient says something. So maybe they can use the phrase like, no, it is not like that, okay? Or I told you we will do this only if this happens. So if they are trying to correct the patient in some way. Now let us look at the answer choice. Which tooth will be replaced? Now if this is the correct answer, they can have conversation about the location of the tooth, because obviously it is with healthcare professional, not with healthcare professional, but a patient. So they wouldn't be referring to the numbers the way we usually refer to. So they would be talking about the location, more about the location. The patient might have misunderstood the location, which tooth would be replaced. Then the extent of surgery required. What do you all mean by extent? Extent? How deep or how detailed, or what actually it would involve. So the extent of surgery, how much invasive it is going to be, or how detailed the surgery is going to be, and how much would it cost. So has the patient misunderstood the cost? So the patient might have thought that it can be done in so and so amount, but the dentist would then correct them that no, actually it would be more costly or maybe cheaper than what they have understood. So all three answer choices are different here. This is about which tooth. This is about the procedure itself, how extensive the procedure would be. And third one is about the cost. Again, here you can expect to listen all three options in the audio. You have to find out what have they misunderstood. So I'm going to play it now.
So that's all done. Was there anything you wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone, but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach 2 teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
Okay. Does any one of you want me to play this again? I can do that for you if you want. Yeah, definitely I would do that.
So that's all done. Was there anything you wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone, but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach 2 teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
Okay, so again, I see A, B, C, all the options coming along. Yeah, so it's correct. B is the correct answer here. Okay, because patient thought that directly they would put an implant there, connecting it to the tooth next door. But the the dentist was explaining that that option would have been possible only if they had lost the other tooth too. But they haven't lost. So the procedure is now going to be more detailed or more extensive because they would have to first extract that tooth and then put an implant there. And then the patient was just confirming that, now he understands why this is going to cost more. So they did talk about the cost, but it was not something that he had misunderstood. He had realized that it is much more than the procedure that they had before, but why it is much more that they have now understood. So they misunderstood the extent of surgery required. If I explain the same thing to you with the help of transcript. So I've got the big gap, and I remember you said we might do an implant there too, but it would be a slightly different procedure. So what they thought is that they would put an implant using the tooth or the adjacent tooth. Is that right? So the doctor corrected them by saying, well, it is partly correct. It is true that they are going to put implant and use the tooth next door, but only if the next tooth was also lost. What we would do if you lost the next tooth along. So now he has not lost. So we would have to extract that one. That would be first step. And then they would need a bone graft. And then finally the implant can be put there. So that is the extent of the procedure or the surgery that would be required. Okay, now next 2 questions. Okay, yeah, just 1, not 2. This was the 5th one. So this is going to be the final question for today, and then we would move on to the next module. So here it says, you hear a doctor in an eye clinic. So maybe an ophthalmologist talking to a nurse about a patient. So this is going to be slightly more technical conversation because two healthcare professionals are discussing it. What does the doctor want the nurse to do? See, this is typically future action question. Yeah? Because what is to be done next? So you should not get taken away by the questions or by the sentences which or the things which have already been done. And what does the doctor want the nurse to do? So if doctor is going to do something or if doctor has already done something, that's not your answer. What he wants the nurse to do is your answer. So here if you look at the answer choices, inform, check, reassure. So what he wants the nurse to do? Does he want the nurse to inform? Inform about what? Extra help available locally. So this can be the support groups, okay, or local day centers and things like that. Check the eye drops are causing the patient no further discomfort. So checking that the patient is not having any discomfort because of the eye drops, and reassure the patient for what? About the treatment that she is going to have in future. Right? Again, you will hear something about all three aspects. Your focus is what the nurse has to do next. Okay? Not about the things which nurse probably has already done, because this is a future action question. And not the things which doctors probably have done or the doctor is gonna do now. So I'll be playing this extract.
Right. Mrs. Taylor is a little upset, and so it would be good if you could talk to her a bit more before she goes.
Sure. She was complaining about the dilating eye drops I put in before you examined her, so I hope things settled down.
Yes, and she won't need to take any home with her. I think the issue going forward is the treatment plan. She's anxious about having injections in the eye for her macular degeneration. I've explained it's not painful and there's a high success rate, so don't feel you need to go through all that again, at least not today.
Okay.
She could do with some information about counselling services, though.
Okay, I'll give her the leaflets. Also, the one for support groups in the area. She sounds as if she may need something like that.
Thanks.
Okay. So here you did have something about the eye drops and the treatment that she's going to have. Let us look at the transcript, what it has to say. Look at the transcript here. The nurse expressed a concern that she was complaining. The doctor said that yes, and she won't need to take any home with her. I think the issue going forward is, so here it helps you to rule out the B option, that it is nothing about the eye drops because she will not have them in the future. But the problem that is going to have next is the treatment plan. And the doctor explained how she is anxious about having injections. But the doctor himself then said that I have explained that it is not painful and there is a high success rate. So don't feel you need to go through. This is very, very common trick. In both listening part B and listening part C, the negatives will not straight away come as negative. Instead of saying you are wrong, I would say, I don't think you are right. So you may just pick up you are right. You may miss that part. Don't. So here he said, so don't feel you need to go through all that again, at least not today. So definitely the nurse doesn't have to do it again. She could do, what she can do is, she can help with information on counseling services. And the nurse also said that she's going to go give the leaflets about the local support groups in the area. That may be something that she would find helpful. Yeah? So be very, very careful. Sometimes the negatives may come like this. The typical style is this. I don't feel you need to go through, and you might pick up you need to go through. So that is wrong. And similarly, they might use words like seldom, rarely, hardly. I'm sorry for the spelling error. So make sure that you are not missing these negatives here. Right? So the correct answer here is A. The doctor wants the nurse to help her with the support services, extra help that is available locally. Because about discomfort, she wouldn't need those drops, so that's sorted. And about reassurance, the doctor clearly said that I have done those things and I don't think you need to do it again, at least not today. So A is the correct answer here. So it is a combination of strategy and practice that is definitely going to help you improve your score. We are trying to get maximum correct answer here. If not 6, then at least 5 out of 6 you should be getting to make sure that you pass the listening test. And it is easier to score in part B provided that you understand the question types and you know how to deal with that particular question. Right? Now, before I move on to any other topic, do you have any questions?